Let's talk about Crohn's disease. It's a condition that many people have questions about, and understanding the basics is the first step in managing it effectively. Crohn's disease is a chronic condition, meaning it's a long-term illness that requires ongoing management and care. It's not something that simply goes away. At its core, Crohn's causes inflammation. This inflammation can occur anywhere along your digestive tract, from the mouth all the way to the anus. However, it most often affects the area where the small intestine meets the large intestine. This region is a common site for inflammation in Crohn's patients. Crohn's is classified as a type of inflammatory bowel disease, often referred to as IBD. IBD encompasses a group of conditions that cause chronic inflammation in the digestive tract. It's important to remember that Crohn's disease is not contagious. You cannot catch it from someone else through contact or shared items. The precise cause of Crohn's disease remains a mystery. Medical researchers are still working to fully understand all the factors involved. However, current understanding points to a combination of genetic predisposition and immune system dysfunction as major contributing factors. Having a close relative, such as a parent, sibling, or child, with Crohn's disease significantly increases your own risk of developing the condition. In individuals with Crohn's, the immune system mistakenly identifies harmless bacteria, food, or other substances in the gut as threats. It then launches an attack on healthy cells. This misguided immune response leads to chronic inflammation, which damages the digestive tract and causes the various symptoms associated with Crohn's disease. Crohn's disease can affect people of all ages, genders, and ethnic backgrounds. While it can occur at any age, Crohn's is most commonly diagnosed in adolescents and young adults, often between the ages of 15 and 35. Certain lifestyle factors, such as cigarette smoking, and environmental factors, such as living in a developed urban area, have been linked to an increased risk of developing Crohn's. Currently, there is no known cure for Crohn's disease. It's a condition that individuals typically manage throughout their lives. However, despite the lack of a cure, significant advancements in treatment have been made, offering hope for improved quality of life. The course of Crohn's disease is characterized by periods of active disease, known as flare-ups, where symptoms are present and can be quite bothersome. These flare-ups are interspersed with periods of remission, during which symptoms subside or disappear altogether, allowing for a more comfortable and active lifestyle. The primary goals of treatment are to reduce inflammation in the digestive tract, achieve and maintain remission, and prevent potential complications associated with the disease. With appropriate medical care, lifestyle adjustments, and ongoing support, many individuals with Crohn's disease are able to lead fulfilling, active, and productive lives. A thorough understanding of your condition, including its symptoms, potential complications, and available treatment options, is an essential first step in taking control of your health. The support and guidance of healthcare professionals, along with the understanding and encouragement of family and friends, play a vital role in managing Crohn's disease effectively. Staying informed about the latest research and treatment options and actively participating in your own care are crucial for achieving the best possible outcomes. Living with Crohn's disease can present numerous challenges, both physically and emotionally. But remember, you are not alone in this journey. There are many resources and support networks available to help you navigate the challenges and live a full life. Crohn's symptoms vary significantly from person to person, making it a challenging condition to understand and manage. However, the most common indicators often include persistent diarrhea, which can be quite debilitating and disruptive. You may also experience abdominal pain, often localized in the lower right side, a cramping sensation that can range from mild to severe. The frequent and urgent need for bowel movements is another hallmark symptom, adding to the discomfort and inconvenience. These symptoms can significantly disrupt daily life, making it difficult to maintain a normal routine. The unpredictable nature of Crohn's can make attending school or performing well at work particularly challenging. Unintentional weight loss is another common sign, often due to decreased appetite and malabsorption of nutrients. Profound fatigue, a persistent feeling of tiredness and lack of energy, is also frequently reported. In some cases, individuals may experience a low-grade fever, indicating underlying inflammation. Crohn's can lead to malnutrition, as the body struggles to absorb essential vitamins and minerals. This occurs because inflammation in the digestive tract interferes with the normal process of nutrient absorption. Beyond the gut, Crohn's may manifest in other areas, such as the joints, causing pain and stiffness. It can also affect the skin, leading to rashes and lesions and the eyes, causing inflammation and discomfort. These extraintestinal manifestations can result in pain, swelling, or redness in the affected areas. These diverse symptoms highlight that Crohn's is a systemic disease, impacting multiple body systems. It's important to recognize that Crohn's is not just a gut issue, it's a condition that can have far-reaching effects. The course of Crohn's is often characterized by periods where symptoms come and go. During flare-ups, symptoms intensify, and you can feel very sick and debilitated. Conversely, remissions bring much-needed relief, with a reduction or absence of symptoms. The specific pattern of flares and remissions varies significantly from person to person. Everyone's experience is different. Some individuals may experience long periods of remission, enjoying relatively symptom-free lives for extended durations. Others may have more frequent flares requiring ongoing medical attention and adjustments to their treatment plan. Keeping a detailed symptom journal can be an invaluable tool for managing Crohn's. This journal helps you and your doctor identify patterns, triggers, and the effectiveness of your treatment. It's crucial to promptly report any new or changing symptoms to your doctor for proper evaluation. Early recognition of symptoms and open communication with your healthcare provider are absolutely key to achieving effective management of Crohn's disease and improving your quality of life. Therefore, it's essential to stay alert to your body's signals and proactively address any concerns that may arise. Diagnosing Crohn's isn't simple. There's no single test. Doctors start with your medical and family history, then a physical exam to check for abdominal tenderness and other signs. Blood tests look for inflammation and anemia, while stool samples rule out infections. Endoscopy and colonoscopy let doctors see inflammation and take tissue samples for biopsy. Imaging tests like CT or MRI scans show inflammation in areas scopes can't reach. Capsule endoscopy, swallowing a tiny camera, can capture images throughout your digestive tract. Diagnosis is a process of piecing together clues from your history, exams, labs, and images. It may take time, but a thorough approach ensures accuracy. The right diagnosis leads to the right treatment. The main goal in treating Crohn's is to control inflammation and keep you in remission. First-line treatments are anti-inflammatory drugs, like aminosalicylates for mild cases. Corticosteroids are used for short-term control during flare-ups, but not for long-term use due to side effects. Immune system suppressors, such as azathioprine or methotrexate, help reduce inflammation but require careful monitoring. Biologics are advanced therapies that target specific proteins causing inflammation, often used when other treatments fail. These medications can be life-changing for many. Sometimes surgery is needed for complications like blockages or abscesses, or if medications aren't effective. Surgery removes diseased sections but isn't a cure. Crohn's can return elsewhere. Treatment is personalized, balancing benefits and risks. Ongoing care and communication with your doctor are essential. Managing Crohn's disease effectively goes beyond simply taking medication. It's about adopting a holistic approach that considers various aspects of your life. Your lifestyle choices truly matter. When it comes to diet, remember there's no one-size-fits-all approach. There's no universal Crohn's diet that works for everyone. However, tracking the foods you eat and how they make you feel can be incredibly helpful. This allows you to identify and avoid potential triggers that worsen your symptoms. During flares, when symptoms are at their worst, smaller, more frequent meals and ensuring you get plenty of fluids can significantly ease your symptoms and help you stay hydrated. Incorporating gentle exercise like walking or practicing yoga not only supports your overall physical health, but also plays a crucial role in reducing stress levels. It's important to listen to your body's signals and prioritize rest when needed. At the same time, try to stay as active as you comfortably can, even on days when you don't feel your best. Effective stress management is absolutely vital, and incorporating techniques like mindfulness, regular meditation, or participating in support groups can be incredibly beneficial in managing stress and improving your overall well-being. Connecting with others who truly understand what you're going through makes a significant difference in coping with Crohn's. The good news is that advances in medical research mean that new and improved treatments are constantly emerging, offering hope for better management and improved quality of life. With the right medical care, a strong support system, you absolutely can lead a full and meaningful life, despite the challenges of Crohn's. Remember to take an active role in managing your health and actively build a strong and reliable support system around you. Living with Crohn's is undoubtedly a challenge, But remember that you have the inner strength and power to not just cope, but to truly thrive and live a fulfilling life.